Hello, everyone. Cardiac arrest is the most life-threatening emergency that you, as a medical professional, will ever face. Every second matters. Time is life. What you do in those first moments can truly save a life. When somebody suddenly collapses or becomes unresponsive, always think about cardiac arrest first. Many people fail to recognize it, and unfortunately, precious time is lost. Cardiac arrest can happen anywhere, at home, in public places, and even in hospitals. Before you approach the victim, make sure the scene is safe. For example, if someone collapses after an electric shock, don't touch them until the power supply is switched off. In hospitals, the scene is generally considered safe. To identify cardiac arrest, remember the triad: unresponsiveness, pulselessness, and breathlessness. First, check responsiveness. Tap the patient firmly on the shoulder and shout loudly. If there is no response, simultaneously check for pulse and breathing. The best site to check for a pulse is the carotid artery. Radial pulses may be unreliable in elderly patients, those with vascular disease, or in shock. To feel the carotid pulse, turn the patient's head slightly to one side. Locate the thyroid cartilage, then slide 3 fingers into the groove between the trachea and the sternocleidomastoid muscle. Check for at least 5 seconds, but not more than 10. While doing this, look at the chest for breathing. If you see agonal gasps, that is not normal breathing. It is a sign of cardiac arrest. So if the patient is unresponsive, pulseless, and not breathing, or only gasping, call for help immediately. Activate the code blue or emergency response system. Your immediate responsibility is to start high-quality CPR. The cornerstone of CPR is effective chest compressions. Chest compressions maintain blood flow to vital organs, the brain, and the heart. Stand or kneel beside the patient's shoulder. Place the heel of your dominant hand on the lower half of the sternum. Put your other hand on top, lock your elbows, and let your shoulders provide the force. Push hard, at least 5 cm or 2 inches deep, but not more than 6 cm. Compress at a rate of 100 to 120 per minute, with full chest recoil after each push. After 30 compressions, give 2 rescue breaths using a bag mask. To ventilate effectively, ensure a tight mask seal and open the airway with a jaw thrust maneuver. The CE clamp technique is excellent. The C part gives you the seal, and the E part lifts the jaw. Deliver each breath slowly over 1 second, just enough to see chest rise. So the ratio is 30 compressions to 2 breaths. If an advanced airway, like an endotracheal tube, is in place, give continuous compressions with 1 breath every 6 seconds. Avoid hyperventilation, as it increases intrathoracic pressure and reduces venous return, lowering cardiac output. The most important rule in CPR is this: minimize interruptions in chest compressions. Interruptions reduce blood flow to the brain and heart and worsen outcomes. Only pause briefly when absolutely necessary, like switching compressors, delivering breaths, analyzing rhythm, or intubating. Remember, CPR triples the chance of survival. CPR saves lives. If you found this useful, please subscribe to my channel, like, and leave a comment. Thank you.